Does overactive bladder increase the risk of infections? Have you ever wondered if having an overactive bladder might lead to more infections? Overactive bladder, or OAB, is a condition that causes sudden urges to urinate, frequent trips to the bathroom, and sometimes even accidents. While OAB itself is not an infection, it can indeed increase the risk of urinary tract infections, commonly known as UTIs, in several ways. One of the main reasons OAB can raise the risk of infections is due to the bladder dysfunction it causes. When someone has OAB, they may not fully empty their bladder. This incomplete emptying can leave urine sitting in the bladder for longer periods. When urine stays in the bladder, it can create an environment where bacteria can grow. Additionally, frequent urges to urinate and episodes of incontinence can lead to increased chances of bacteria entering the urinary tract from the urethra or surrounding areas. This is especially true if hygiene practices are not maintained during these frequent trips to the bathroom. The irritation and inflammation that come with OAB symptoms can also weaken the bladder's natural defenses. This can make it easier for infections to take hold. For those managing OAB with methods like intermittent catheterization or using absorbent products, there is an added risk of introducing bacteria into the urinary tract. It is crucial to understand that while OAB does not directly cause infections, the behaviors and symptoms associated with it can make infections more likely if not managed properly. If someone with OAB experiences recurrent infections, it is important for them to consult a healthcare professional. This can help rule out other conditions and improve bladder management strategies. Moreover, while chronic irritation from OAB could theoretically relate to bladder cancer risk, there is no solid evidence that OAB alone increases this risk. However, managing infections effectively and maintaining bladder health is essential. In summary, overactive bladder can indirectly increase the risk of urinary tract infections through incomplete bladder emptying, frequent urination, and irritation. Proper diagnosis and management are key to reducing this risk. If you have OAB and are facing recurrent infections, seeking personalized medical advice is a wise step to take.